Today, we're going to review the new clinical practice guideline for management of acne, published by the American Academy of Dermatology, or AAD for short. This guideline was published January 30th, 2024 in the Journal of the American Academy of Dermatology. Acne vulgaris commonly affects adults, adolescents, and pre-adolescents aged 9 years or older, and the purpose of this guideline is to provide evidence-based recommendations for the management of acne in those populations. This guideline updates the 2016 AAD acne guidelines, which resulted in 18 evidence-based recommendations and 5 additional good practice statements. The target patient population is adults, adolescents, and pre-adolescents aged 9 years and older, and the target provider population is U.S. and Canadian dermatologists and other allied providers who treat patients struggling with acne. This guideline was developed using the Grading of Recommendations Assessment Development and Evaluation Evidence to Decision Framework, also known as GRADE. This framework categorizes recommendations by the strength of recommendation, either strong or conditional, the certainty of evidence, either high, moderate, low, or very low, and there are also good practice statements. These are viewed by the work group as imperative to clinical practice and developed when using supporting evidence was considerable but indirect, and the certainty surrounding the intervention's impact was high, with the benefits clearly outweighing the harms or vice versa. Recommendations. So without further ado, we'll go ahead and jump into the recommendations, starting with topical agents. When managing acne with topical medications, the AAD recommends multimodal therapy combining multiple mechanisms of action, and this is a good practice statement. For patients with acne, AAD recommends benzoyl peroxide. This is a strong recommendation, moderate quality of evidence. For patients with acne, AAD recommends topical retinoids. This is a strong recommendation, moderate quality of evidence. For patients with acne, AAD recommends topical antibiotics. This is a strong recommendation, moderate quality of evidence, with a caveat: topical antibiotic monotherapy is not recommended. For patients with acne, AAD conditionally recommends clascaretin. This is a conditional recommendation, high quality of evidence. For patients with acne, AAD conditionally recommends salicylic acid. This is a conditional recommendation, low quality of evidence. For patients with acne, AAD conditionally recommends azelaic acid. Conditional recommendation, moderate quality of evidence. For patients with acne, AAD recommends fixed-dose combinations of topical antibiotic with benzoyl peroxide. This is a strong recommendation, moderate quality of evidence. For patients with acne, AAD recommends a fixed-dose combination of a topical retinoid with a topical antibiotic. This is a strong recommendation, moderate quality of evidence, with a note or a caveat: concomitant use of benzoyl peroxide is recommended to prevent the development of antibiotic resistance. For patients with acne, AAD recommends fixed-dose combination topical retinoid with benzoyl peroxide. A strong recommendation, moderate quality of evidence. Next up, we'll get into the systemic antibiotics. For patients with acne, AAD recommends doxycycline. This is a strong recommendation, moderate quality of evidence. For patients with acne, AAD conditionally recommends minocycline. This is a conditional recommendation, moderate quality of evidence. For patients with acne, AAD conditionally recommends sarecycline. This is a conditional recommendation, high quality of evidence. For patients with acne, AAD conditionally recommends doxycycline over azithromycin, a conditional recommendation, low quality of evidence. For patients with acne, AAD recommends limiting the use of systemic antibiotics whenever possible to reduce the development of antibiotic resistance and other antibiotic-associated complications, a good practice statement. It is recommended that systemic antibiotics are used concomitantly with benzoyl peroxide and other topical therapies. This is a good practice statement. Now we'll go to the hormonal agents. For patients with acne, AAD conditionally recommends combined oral contraceptive pills. This is a conditional recommendation, moderate quality of evidence. For patients with acne, AAD conditionally recommends spironolactone. This is a conditional recommendation, moderate quality of evidence. Note: potassium monitoring is not needed in healthy patients. However, consider potassium testing for those with risk factors for hyperkalemia. This includes older age individuals with medical comorbidities or other medications that may cause hyperkalemia. For patients with larger acne papules or nodules, AAD recommends intralesional corticosteroid injections as an adjuvant therapy. This is a good practice statement. Intralesional corticosteroid injections should be used judiciously for patients who are at risk of acne scarring and/or for rapid improvement in inflammation and pain. Using a lower concentration and volume of corticosteroid can minimize the risks of local corticosteroid adverse events. And now for the final recommendations and classes. For patients with severe acne or for patients who have failed standard treatment with an oral or topical therapy, AAD recommends isotretinoin. This is a good practice statement. Acne patients with psychosocial burden or scarring should be considered as having severe acne and to be candidates for isotretinoin. For patients undergoing treatment with isotretinoin, monitoring of LFTs and lipids should be considered, but CBC monitoring is not needed in healthy patients. Population-based studies have not identified increased risk of neuropsychiatric conditions or inflammatory bowel diseases in acne patients undergoing treatment with isotretinoin. For persons of childbearing potential, pregnancy prevention is mandatory. For patients with severe acne, AAD conditionally recommends traditional daily dosing of isotretinoin over intermittent dosing of isotretinoin. This is a conditional recommendation, low quality of evidence. For patients prescribed isotretinoin, AAD conditionally recommends either standard isotretinoin or low-dose isotretinoin. This is a conditional recommendation, high quality of evidence. For patients with acne, AAD conditionally recommends against adding pneumatic broadband light to adapalene 0.3% gel. This is a conditional recommendation, low quality of evidence. We're going to do a quick summary for you. Strong recommendations are made for the following: topical benzoyl peroxide, retinoids, and/or antibiotics and their fixed-dose combinations, and for oral doxycycline, oral isotretinoin is strongly recommended for severe acne, acne-causing psychosocial burden or scarring, or acne failing standard treatment with oral or topical therapy. Conditional recommendations are made for the use of topical clascoterone, salicylic acid, azelaic acid, oral monocycline, cerealicine, combined oral contraceptives, and spironolactone. Using topical therapies combining multiple mechanisms of action, limiting systemic antibiotic use, combining systemic antibiotics with benzoyl peroxide and other topical therapies, and adjuvant intralesional corticosteroid injections are recommended as good clinical practices. In addition to the recommendations, the guideline also includes a key management figure or algorithm, which we'll now show you on the screen. So there you have it, a recap of the 2024 AAD guidelines for acne. For more information on this guideline or to access the guideline summary, patient summary, or for any of our other resources, visit us online at guidelinecentral.com or download the Guideline Central mobile app available on iOS and Android devices. This has been a Guideline Central production, and we'll see you soon for the next one.